Okay, good morning, student everyone. So yesterday, whatever we have discussed now, all this normal value and all, like, do you have any questions? Like, you want to ask anything? Like the normal value, you miss out anything? Just the normal value. We will not go on brief detail about that. Just the normal value. You miss out anything? And I already upload this one video also. So still, if you have any like any point missing or any unit missing?
No, ma'am.
Okay.
Ma'am, from the enzymes that aspartate transaminase.
Yesterday, like I already actually, what happened? That question, many of them like asked me yesterday while I was discussing. Like I was so fast or what? I was so speed or what? I mean,
No, ma'am.
many of you like could not catch that, nah? You write it down, 10 to 50 U per L, okay? You are asking me about aspartate transaminase, right?
Yes, ma'am.
Okay, 10 to 50 U per L, okay? U per liter. U is unit.
Yes, ma'am. Thank you, ma'am.
Okay, welcome. Okay, so like your exam is approaching now. Your exam is very near. So we will do one thing, like we have even like completed the syllabus. We completed all the revisions of whatever like I have taught you all now. But still, like we will keep on like revising so that means it will be very helpful in your exam now. So today, like we will have a revisions on nephrotic syndrome once again, okay? And then if you want to, like, we will just before our exam now, we will try to cover up revision once again all those topic that we finished. But still, you can suggest me also, like you can text in group also now, like tomorrow we will have revision again on this chapter, like this. You can give your own like point of view now, so you can share it, okay?
Okay, ma'am.
Okay. Okay, just wait a minute. Okay, there is a problem in sharing the screen. All of you, like, you just take out the notes, okay? That I have given you all. All of you, have you seen your routine? On which date you have
Yeah.
CRD? On which date you have CRD?
24.
This 24th July, okay. Can you see the screen?
Yes, ma'am.
Okay, it's today we will have again revisions of this nephrotic syndrome. Okay, so Nafishisa, what was the definition of nephrotic syndrome?
Nephrotic syndrome is a primary glomerular disease, which is characterized by high level of protein, a low level of protein in the blood,
High level
increased
of
level of
protein.
lipid in the blood,
Okay, okay. Say.
and edema.
Okay. Darshana, what do you mean by nephro?
Kidney.
So this
Nephro-
okay. So what we have discussed on nephrotic syndrome was that it was like coined by two words, no? Nephrotic syndrome. One was the nephro and the other one was the syndrome. So nephro meaning was the kidney and the syndrome meaning was the group of symptoms. So that was all about the introduction. So now coming to the definition, which is the most important. So nephrotic syndrome, it is a primary glomerular disease, okay? So which is characterized by all this. So like all of you, like, you know, like when you listen explanation carefully, na, just before your final exam also, you will just need a revision. So you don't need to like study. Just by understanding, you can just mark up everything. So please concentrate. It is characterized by high level of protein. That is the other name of protein. We also call it as albumin, okay, in the urine. So if we won't write high level of protein, then in place of high level of protein in the urine, you can also simply write proteinuria. So the meaning are same. So this is the first characteristic features. So the other one is there will be low level of protein in blood, okay? High level of protein in the urine, but there will be low level of protein in the blood. And low level of protein in the blood is also known as hypoalbuminemia. So both the term you try to know, okay? When you write hypoalbuminemia, or then also like you try to know that the meaning is this. And when you just write low level of protein in the blood, then also try to know the meaning is this. So both sides you need to know. So there will be increased level of lipid. So increased level of lipid is also known as hyperlipidemia. So, and then swelling of the body part. All of you know swelling of the body part is also called edema. So when your whole body swelling is known as what? Ilasara. Ilasara, whole body swelling is known as what? Your whole body swelling.
Forgot, ma'am.
Okay, no problem. Ishan, can you please tell me your whole body is swelling? So it is an edema, but what was the name? Ishan,
Ma'am,
say. It's wrong or right, you just say. Ishan, say. What was that? Or you forgot?
ma'am,
Okay, no problem. See, like you all don't use to revise, nah? That's why. Okay, who can tell me? Rashmi, can you please tell me what is the term that we use for whole body swelling?
Forward, ma'am.
Okay, who can tell? Surajit, can you please tell me? Sharir pe jab
Enna sarkam.
what Surajit?
Enna sarkam.
Very
Enna sarkam.
okay. Very good, Surajit. I did not expect, but it's very, very good. Okay, it's Enna Sarka. All of you don't forget it's Enna Sarka. So edema also like different types. Now, and you have discussed the brief discussion about edema in your this applied anatomy class. Now, so Enna Sarka was the whole body swelling. So don't forget. And so what you will have in the nephrotic syndrome, so a patient will have high level of protein in the urine, low level of protein in the blood, and there will be increased level of lipid, that is hyperlipidemia, and there will be swelling of the body part, so which is also called edema. These are the features, so don't forget and don't get confused also, okay? So are you clear with the definition once again, all of you?
Yes, ma'am. Yes, ma'am.
Okay, so let's move. So the next was nephrotic syndrome can affect all age group. This one I keep on mentioning, okay? This nephrotic syndrome, what happened is that this syndrome, it can affect all type of age group, means like since birth, okay? Since the child birth till the advanced age, that is the old age, it can affect everyone. But what happened is that it is, children are mainly affected, okay? So from in children also, like the age between 2 to 6 years are much more susceptible, okay, to have this kind of diseases, that is nephrotic syndrome. Dosage 6 साल तक, 2 to 6 years. And then when we compare between the male and the female, okay, the male are slightly more likely to be affected than females. That means male are like more common, okay, to have this nephrotic syndrome as compared to female. So are you clear about the
Yes,
like
ma'am.
affected age group, as well as the which one are more like affected, male or female? All of you, are you clear?
Yes, ma'am.
Okay, all this we already discussed now, so just now just focus, okay, so that like you won't get confused. So what are the causes? So now we came to know now what is nephrotic syndrome. It is characterized by what features? So now let us see what causes this disease, okay? There are many diseases and conditions that can cause glomerular damage, and this will lead to nephrotic syndrome, including systemic lupus erythematous. So this one already, I already discussed. This is systematic lupus erythematous, and you all know that lupus, this is a disease that can affect multiple organs of the body, okay, including the kidney. And nephrotic syndrome is common in people with severe lupus. So you know that now lupus means what? It is a disease. This will affect your multiple organ. It might affect your kidney. It might affect your liver, okay, etc, etc. It might affect multiple organs. So क्या होता है कि when our multiple organs are being affected, okay, at the time we will have like severe, like susceptible to develop this nephrotic syndrome. That is why those who have severe lupus, that is multiple organ diseases, now multiple organ disease also the most severe one, okay, it's not like the mild one, severe one. If someone have severe lupus, so severe diseases, okay, and at that time what happened, to have this nephrotic syndrome disease is very very common. So this is the causes. तो ये सब systematic lupus erythematous का वजह से भी nephrotic syndrome हो सकता है. That is why this is the causes. Next is heart failure. Okay, all of you know what is heart failure, and then some of the medical condition that can damage kidney. Okay, there are like medical conditions, means there are certain diseases and condition that increases the risk of developing nephrotic syndrome, okay, such as what are those medical or like medical condition, okay, that will that will increase to develop nephrotic syndrome. Those are such as if a person have diabetes, and just now we discussed about lupus, okay, lupus, amyloidosis, all this I have explained. What was amyloidosis? All of you have written the notes, I think. What was amyloidosis, Regina? What was amyloidosis?
Abnormal protein buildup.
Unable to?
Abnormal protein buildup.
Yes, abnormal protein build. Okay. So such as diabetes, lupus, amyloidosis, and other kidney disease. Okay. So these are the medical condition. Okay. If you have this kind of medical condition, medical problem, please don't make noise. Who is that? Please don't make noise. So there are certain like medical condition. Okay. These are the medical condition. If you have this kind of problem, this will increase you to like have this nephrotic syndrome diseases. So next, coming to the next, there are certain that what we have discussed just now was about the medical conditions. Okay, now what we will be discussing again is about the certain medications that will increase someone to develop nephrotic syndrome. So what are those medications? So the medication that can cause nephrotic syndrome will include non-steroidal anti-inflammatory drugs. Okay, that is NSAID. These are the like anti-inflammatory drugs. Okay, and also those are those drugs that are used to fight infections. So infections. So what are the drugs that used to fight infections? Samuel, can you tell me what type of drugs we take to kill the means to prevent from infections? Samuel, I think Samuel is absent or what? Okay, Nafisisa, can you please tell me what are the drugs that used to fight infection?
Ma'am,
Nafish,
antibiotics.
yes, very good. So these are the certain medication. Okay, like intake of all this medication are good, but this why it is written, okay, that this why this come under the causes of developing nephrotic syndrome. The only thing is that when someone take any kind of medication, when they take overdose, okay, intake of overdose or intake of too much of medication of all this can lead to like nephrotic syndrome. So and mainly there are so many medication, but these medication are mainly mentioned, okay, because these medication are susceptible to develop nephrotic syndrome. That's why. So coming to the next are certain infection. Okay, there are certain infection. What type of infection? Certain infections that will increase nephrotic syndrome include HIV, okay, and hepatitis B, hepatitis C, and all this malaria. All these are the certain kind of infections that can cause a person to develop nephrotic syndrome. So like what was the full form of HIV? Ilasara, can you please tell me what is the full form of HIV?
Human immunodeficiency virus.
Yes, very good. So these are the like infection. Okay, if someone caused this kind of infection, then he or she is like at risk of developing nephrotic syndrome. So next is chronic glomerular nephritis, where there is when there occurs an inflammations of the glomeruli. Okay, and that inflammation is not the mild or moderate one. It is very much chronic. Okay, chronic means that particular disease occur or that particular inflammations or that particular infections occur for a longer period of time. Okay, so when your glomeruli is infected, okay, is inflamed for a longer period of time, okay, then what happens is that can also lead to develop nephrotic syndrome. So next is renal vein thrombosis. So when there is a like renal vein thrombosis, that can also cause nephrotic syndrome. So all of you, are you clear about the causes? It's very simple. So it's just all of you.
Yes, ma'am.
If it comes in exam, will you be able to write? Yes or no?
Yes, ma'am.
Okay. Whom will I ask? Is Trishna Rasbungsi present? Is Trishna Rasbungsi present? Bishal, can you please tell me what is the full form of an NSAID? Bishal, can you please tell me what is the full form of NSAID?
NSID.
Yes, NSAID. Abhi discuss kiya. N stand for Bishal. You don't have the notes.
Yeah. That's right.
Okay, then Bishal, no problem. I will pass someone else. Nunu, can you please tell me what is NSAID?
Yes, ma'am.
Yes, can you please tell me what is the full form of an NSAID? If you're confused, I will ask someone else.
Ma'am, I don't know.
Okay, long jump, can you please tell me what is the meaning of NSAID? Full form. Long jump. Malvina, can you please tell me? Malvina?
Yes, ma'am.
Yeah, what is the full form of NSAID?
Non-steroidal anti-inflammatory drug.
It's very good. Okay, it's non-steroidal anti-inflammatory drug. Okay. Okay, next let us discuss about the clinical manifestation. Okay, so we already know the definitions. We already study about the introductions, how this nephrotic syndrome it derived. Okay, it was derived from the two Greek word, and after that, how the definition is, what are the characteristic features, and then what causes nephrotic syndrome. And now we will be discussing about the clinical these features, which is also known as like sign and symptoms. So first of all, if someone have nephrotic syndrome, the most common 100% common clinical manifestation is swelling over the like body. Okay, so it's swelling. So swelling that occurs in people with nephrotic syndrome commonly affect the lining of the eye socket, which often causes swelling around the eye. So this one I will be showing you all the picture. This, see, when the like lining of your eye socket is being like affected. Okay, so what happened is that there occurs edema like this. This is the picture you can see. So if someone have nephrotic syndrome na, especially the children na 2 to 6 years, so aisa hota hai. So this is the most common symptoms. So, and then the other one is swelling edema can also occur in the feet. That means swelling can also occur in the feet as well as in your ankle after sitting or standing for any period of time. Means like when you like stand for a long period of time, or else when you sit for a long period of time, what happens is that like if you are having nephrotic syndrome, that can lead to this swelling, okay, over the area, over your feet or your ankle, wherever it is. And ultimately the edema become generalized and can be massive. So slowly and steadily what happens is that at first the edema might occur in one particular area, suppose only the here, okay, in the lining of the eye socket, it might occur here. But what happens is that slowly and steadily it can also be massive, and that ultimately led to whole body swelling, which we call it as anasarca. So this is the clinical manifestation. So are you clear with the first clinical manifestation, that is edema? All of you? All of you? Are you clear? Okay. Okay, let's move on. Next is the weight gain. So weight gain, I already discussed with you all now that before I told I will be giving you all about the BMI, that is body mass index. So like whether you have gained your weight or not, everything, like whether your like weight is normal with your height or not, everything like I have already discussed and given you all the normal value, everything now. So you can like calculate with that and know that you are this overweight or not. And then weight gain will obviously be the sign and symptoms of this nephrotic syndrome, because when someone body is accumulated with fluid na, that is edema. Edema means whole body swelling na. So when there is accumulation of fluid in your body, what happens is that that will increase your weight. So that is why weight gain can also be the clinical manifestation of nephrotic syndrome. So next is oliguria. So oliguria, to all of you know, so no need to like repeat this oliguria. So, or else you forgot what is oliguria. All of you, you still remember what was oliguria, or else you already forgot because we have discussed this long way back now. So Rashmi, can you please tell me what was oliguria? If you don't know, I'll pass the question.
Ma'am, urine output less than 400 ml per day.
Yes, very good. Okay. Okay, next. Next is hematuria. So Vishal, I think at least you should know this hematuria because this is very common. Vishal, I asked you one question, you could not answer. That's why I'm asking you again. Vishal, hematuria. Vishal, hematuria, sleeping. Vishal, hematuria. Okay, Monica, what is hematuria? Vishal, what is Monica?
Yes, ma'am.
Yes, Vishal, what is hematuria? Where were you? What is hematuria? Vishal, bolo.
Uh, uh, presence of blood urine.
Blood in urine. Okay, Vishal. Okay. Okay, this also will be seen. And then respiratory distress will also be the symptom. So if ascites is marked, a patient commonly complain of respiratory distress with difficulty in breathing and rapid breathing. So what was ascites? So Srijana, what is ascites? Ascites. Srijana, what is ascites?
Ma'am, abnormal fluid buildup in abdomen.
Okay, very good. So that is ascites. Please take attendance, okay? Okay, so if ascites is marked, patient commonly complain of respiratory. So when you have ascites or when someone have ascites, what happens is that the patient will commonly complain of respiratory distress. Okay, that means they might have difficulty in breathing. So difficulty in breathing is also known as shortness of breath. And then we have discussed the vital signs, na? So there you can like find out whether like the breathing pattern is good or not, like everything, because the normal value was given to you all, na? So with that you can differentiate. And then rapid breathing, so the breathing might be very rapid. And then malaise, headache, irritability, fatigue, all these symptoms can be seen, okay, if someone have like nephrotic syndrome. So infection also can be seen. And then blood clot, if people with nephrotic syndrome are at an increased risk of blood clot in the veins or arteries, okay. So जिसका नेफ्रोटिक सिंड्रोम होता है, हाँ, उसका ब्लड क्लॉट वेन या आर्टरीज में ब्लड क्लॉट होने का बहुत ज्यादा चांसेस होता है. So if the person have nephrotic syndrome, he or she is of greater risk of developing this blood clot in his or her veins or arteries. So, and the clot in the vein can travel to the lung, okay, which is very, very much dangerous, okay. So, and even fatal. So it can even like cause death, okay, death. So that was the number 8 point. The other one is proteinuria. All this you have seen in the characteristic features, na? Proteinuria. So, Evagenia, what is proteinuria? Evagenia? Evagenia is absent. Okay.
Yes, ma'am.
Okay, Evagenia, what is proteinuria? Because we have discussed this. Say fast, because
High
this,
level of protein.
where? High level.
In albumin. Or in the urine. I mean in the urine.
Sheetal, is it correct? High level of protein in the urine. Is it correct, Sheetal? Sheetal is absent.
Yes, ma'am.
Okay. So all this feature you will see again, hypoalbuminemia you will see. So what was the other name of albumin? What was the other name of albumin? Shelly, what was the other name of albumin?
Ma'am, protein.
Okay, very good. And then hyperlipidemia, okay? These are the features you will get. Okay, next, general symptoms. So what are the general symptoms that you can get? Overall symptoms, okay? So regardless of the types of nephrotic syndrome, patients commonly have loss of appetite, that is anorexia, okay? Loss of appetite means anorexia, diarrhea, all this. Raised blood pressure, there is hypertension, and it become irritable, feeling fatigue, and appear pale, okay? The skins become pale. So these are like general symptoms that you might get, okay, if someone have or someone suffer from nephrotic syndrome. So those are the like 10 points, that 10 clinical manifestation that we could find from nephrotic syndrome. So are you clear everything, whatever we discussed, all of you? Number 1 was swelling. Number 2 is weight gain. 3, oliguria, hematuria, respiratory distress, malaise, everything, all this. Are you clear?
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Okay, let's discuss about diagnostic evaluation. So nephrotic syndrome is diagnosed based upon a number of laboratory tests, okay? So urine test is the most like common, like the common test that should be performed. Okay, if they don't perform any test also, the first priority should always be the urine test in case of this nephrotic syndrome patient. Okay, so and next is the blood test, and then next is the kidney biopsy. So kidney biopsy, urine test, you know, blood test also, you know. So this is how like urine is collected. Okay, this is the container you will see in hospital. So you are not exposed to hospital, na? That's why you don't know. So urine test. So this container used to be given, and through this, like the patient collect his or her urine. So after that, blood test. This is the vial. Okay, there are different color of vial. Okay, so because there are different kind of blood tests done, na? CBC, all this, everything different are there. So that is why the vial is also different. So next is kidney biopsy. This is how kidney biopsy is being done. Okay, so this is the this is the biopsy needle. Okay, and this is your kidney, right? And from here, what happened is that small amount of, or some amount of tissue is being taken out from your kidney. Okay, so that tissue is being like observed under the microscope. Okay, and then, or else under the, like for investigation in the lab they used to take. So, and that tissue is taken out with the help of the needle known as biopsy needle. So these are the like laboratory tests or investigation you need to perform in order to diagnose that the patient really suffer from nephrotic syndrome or not. All this you can know from this investigation. So next is management. So the goal of treatment are to relieve symptoms. So the main, when we talk about management, and from the name itself, managing means agar kisi ka bimar hua to you have to treat. Management means treatment. So the goal of the treatment are to relieve the symptoms, prevent complication, and delay progressive kidney damage. So we have seen just now that this controlling blood means hypertension. So controlling blood pressure is the most important measures to delay kidney damage. So what happens is that our kidney, like once your kidney is being damaged, like damaged kidney might progress. Now the damage might progress, and it might lead to chronic and ultimately lead to like kidney failure. So what happens is that so like you have to first of all control the blood pressure. Okay, if you want to delay your kidney to damage. So controlling blood pressure is the first priority. So what you need to do is that you need to keep the blood pressure at or below 130/80 mm of Hg. So you know the normal value. So after knowing the normal value, always try to keep the blood pressure below 130/80 mm of Hg. With this, you can prevent or you can control blood pressure. And so there are certain medication, okay, that can prevent the blood pressure. So the name of those medications are, or the class of drugs are, SCE and ARBS. SCE stand for angiotensin converting enzyme inhibitor, and ARBS stand for angiotensin receptor blocker. So these are the medicines that are mainly given to the patient who have this high blood pressure. So SCE inhibitor may also help decrease the amount of protein loss in the urine. So the protein that is lost in the urine, that can also this SCE inhibitor can decrease. Okay, so this is the most common that is BP medication, blood pressure medication. So next is water pill, and water pill is also known as diuretic. And I have given example you all water pills like furosemide, all this, which is also known as Lasix, all those mannitol, everything I have given you all. Those are the water pill. Okay, it used to help control swelling by increasing kidney fluid output. So because in nephrotic patient, what happens is that the person will have edema. Edema means there will be accumulation of fluid in his or her body. So what happens is that in order to remove all those fluid, okay, so we need to prescribe these water pills, a medication that is diuretic, okay, to to remove all those the fluid that are being accumulated. So this diuretic medication will help, okay, to control the swelling. So how this medication will help controlling swelling? Because once you take this medication, then what happens is that your urine output will be more. So you can excrete more, okay? So That is how it is being working. And corticosteroid, what happened is that this is the mainly the medication that is used to reduce inflammation, any kind of inflammations that occur. Okay, so that is controlled by corticosteroid. So all of you, are you clear? All of you, are you clear?
Yes, ma'am.
Okay, so only 1 minute left. Okay, there is no more time. So, okay, then that's all for today. Okay, thank you, everyone.
Thank you, ma'am.
Okay, ma'am.